Welcome to This Week in Health IT. It's Newsday. Today we have a new sponsor. We have a new co-host. We have a lot of new things. We're going to talk about the transition for a CMO to go into health tech. We're going to break down some predictions, make some predictions of our own, and we're going to talk about the transparency rules. So we've got a lot to talk about today. Looking forward to it. My name is Bill Russell, former healthcare CIO for a 16-hospital system and creator of This Week in Health IT, a channel dedicated to developing the next generation of health IT leaders. If you want to be a part of our mission to become a show sponsor, you can do that. Just send an email to partner@thisweekinhealthit.com. Today, we have a new show sponsor, and I'm excited. And they join our existing show sponsors. We have Worldwide Technology and Platinum Partner Intel, Health Lyrics, and Sirius Healthcare. They are our Newsday show sponsors, and we really appreciate them investing in our mission to develop the next generation of health leaders. Quick note, we launched a new podcast today in Health IT. We do one story every weekday morning. Check it out. You can subscribe wherever you listen to podcasts. All right, let's get to our new guest host, Dr. Sanaz Cordes, who is the Chief Healthcare Advisor for Worldwide Technologies. Prior to that, she has led digital health startups, .com Therapy. She was a part of HealthFinch, Chief Operations and Commercial Officer, and is a pediatrician by training. Good morning, Sanaz, and welcome to the show. I was so close to saying your name right every time. Sorry about that.
You got it right, 2 out of 3. Good morning. Thanks for having me.
Well, welcome to the show. I'm looking forward to this conversation. You have a phenomenal background, and I'm looking forward to not only having this conversation with you, but introducing you to the community. And you started as a pediatrician. How did you get the technology background? How did you get into technology?
Yeah, so I started out as a pediatrician, pediatric hospitalist with Providence Health many years ago. Practiced for a few years with them, and the EHR happened, to be quite honest with you. And I started to see all my colleagues, very talented physicians, start to experience dissatisfaction. All the extra clicking, 2 hours a day of extra clicking. And so I thought there's just got to be a better way, right? Like, you don't build an iPhone and never put any apps on it. So I kind of went on a quest for my own passion, driving that to see what was out there. And so that led me on a 15-year pretty, windy career path that brought me here. But I went in search of, applications that could actually make workflow better and automate some work off of physicians' plates. And that's how I landed there.
And who knew that the EHR implementation and meaningful use would drive so many physicians into the technology world? But it is a great transition. So you not only did that, because a lot of physicians stop there, but you then took the leap and went into the startup world. How did you decide to do that, and what did you learn as an entrepreneur?
Yeah, so after I did about 6 or 7 years in larger organizations, content and CPOE companies back in the day, I realized that, for technology vendors that are building software solutions, that, sometimes in these larger organizations, things just aren't moving fast enough, right? And so with health tech and healthcare needing things happening, yesterday, because that industry moves slow enough as it is, I was really drawn to that startup space. And I was really fortunate in my first role to be pulled into some incubator work and some venture dollars that were set aside by Hearst Healthcare. That was one of my first employers. And yeah, that's when I met, 3 guys in a garage that were PhD dropouts at University of Wisconsin. And, after looking at about 30, 40 different companies, it was amazing, what they were doing at the time with workflow automation. And so that's, I got the bug, and that was HealthFinch in Madison, Wisconsin, led by Jonathan Barron. And I was with them for a few years, and then stayed on and did a couple more startups in Madison. And the most recent was CEO of a teletherapy company called .com Therapy. So yeah, it's been a great ride, and you learn something new every day. And it's great to also look back to see we've actually moved the needle, for folks like me that were crazy enough to make that leap. So it's rewarding.
Yeah, it's interesting. What's the number one thing you learned being an entrepreneur?
You know what? There's always a way. There just has to be, right? I mean, there's times you just think there's no way through this wall. And, what the founder actually at CEO at .com Therapy taught me, like, who moved my cheese? Like you got to get to the other side and get to your cheese, right? And so I always hear that her mantra in my head, but it's true. I mean, the highs are high and they're ecstatic and they're wonderful when you get, that venture capital money wired in after a year and a half journey, but the lows are low, and so you just have to keep remembering that there's got to be a way.
Yeah, you don't even get to ask the question, who moved my cheese? It doesn't matter who moved your cheese. You still have to find the cheese. So keep looking.
That's right.
Oh, man. So you're now helping organizations through worldwide technology. And, where do you find yourself spending your time these days? What kind of challenges are health systems focused in on?
So, yeah, I had the unique opportunity to join Worldwide the day the world shut down with COVID. So last March 26th is when I joined. And it was a really crazy time to come into a company like Worldwide with such a large footprint and, healthcare provider payer side, as well as life science, and doing it all remotely and doing it where, your customers are also in a frenzy. So it was a steep learning curve for all of us. So it's been interesting, my time, the first 3 to 4 months, probably like a lot of other, guests on your show, was spent with stop the bleeding. How do we get tents up? How do we get infrastructure put in place for, the Army Corps of Engineers to do, COVID treatments? And how do we quickly put up virtual care solutions? We had one organization that called us on a Wednesday and we had them up and running on video for visits by the following Tuesday, across 1,000 different sites. So there was a lot of that, the first 3-4 months. And then I was just amazed, talk about moving quickly, moving slowly in healthcare, people moving so quickly. And now, probably like other folks that you speak to, it's kind of moving in a different direction. We realize that a lot of these things are here to stay. So yeah, we're working with folks on how do we scale teletherapy? What do we learn by putting up the quick solutions that may not be sustainable? What's the next frontier? Remote patient monitoring. How do we make that meaningful? A lot of work around AI, machine learning. I think organizations, especially also in life science, have seen the importance of having that structure in place and being able to really drive meaningful use out of their data. And so I'd say, yeah, those 3 categories. And then I think what we're going to see more of, we do a lot of work with our application services and AI team with revenue cycle, and I think when everything's everyone can catch their breath, there's a lot of things to fix that got, broken there, obviously with the financial impact. So we're starting to see a lot of people kind of planning for that as well for this year.
So there's a few things going on. Well, and that's, we're doing the CIO interviews, and that's what I'm asking. One of the questions I ask every one of them is, what are your priorities? And it's interesting. They break it down into 2 categories. It's like the priority to get through the pandemic, and then the priority to really sustain the digital gains. Because one of the silver linings from this has really been the digital transformation that we had been pushing for the better part of a decade or more seems to have really accelerated over the last 9 or 10 months.
100%. Yep. Things that were on a roadmap, that were like on a 6 to 18 month roadmap happen within 6 to 8 weeks now. And it's amazing to kind of watch that happen. And I think they're amazing that, they're surprising themselves that they can do that. So it's pretty phenomenal.
Yeah, it should be interesting. All right. So we're going to get to the news. So the news first story was tailor-made for you. It is your ultimate guide to hiring doctors into digital health. And Chrissy Farr has moved from reporting to investing, but she still produces content. And this is a really good one. She breaks down the jump from being in medical practice to becoming a CMO for a health tech startup. So this is in your wheelhouse, I assume.
It is. Yeah. I've actually, when we chatted about this online, I've actually given talks about this to like developer, conferences for folks building apps for like all scripts and things like that. So yeah, I got a chuckle out of the chance to chat about this today.
Well, it's a great, it's an SEO piece, actually. It's a search engine optimization piece. It has, if you now search for becoming a, health tech CMO, I'm sure this piece is going to rank really high because it answers so many questions, like, the types of different roles and where do you recruit CMOs, and do you continue to practice or not? It answers a bunch of the core questions. So let's just march through some of these. I thought her first distinction was pretty interesting in that the roles, and this wasn't, it was just people she interviewed. They talked about the different types of CMO roles that exist. You can have a CMO of product, and these are probably one of the more rare, but these are the people who are actually physicians who are leading the product development roadmap and cycle and those kind of things. Then you have the CMO of sales, and they say, and I agree with this, a majority of the physicians who get hired into these organizations end up in seat 1A, flying around the country, acting as the spokesman for that product. And I don't think a lot of physicians know that they're signing up for that when they sign up for it, but that is one of the roles that ends up happening. CMO, clinical operations, is the person who bakes it into the clinical workflow and makes sure that it's, it functions well. And then the last one is CMO optics. And we've seen this from time to time. It's when you hire the physician really to be the person you roll out at the conferences, and they write papers and those kind of things. It's about, how it's about making your product synonymous with, high-minded clinical studies and those kind of things. So it's connecting with those two things. How have you seen this? I mean, I've seen all four of those. How have you seen the CMO role in health tech? And, does it fall in these four categories? Have you seen any others?
Yeah, no, I think this was a great article. I actually kind of disagree with a few of the categorizations from Christina. So hopefully, she won't be listening to this. But in my experience, I think that the sales CMO is the hardest role to find. I mean, in the 18 years that I've been doing this, I think I can count on less than the five fingers on one hand how many physicians I've met that can really get in there and do that sales position. And I think it's fundamentally the DNA that is required to draw someone into 8 years of university and 4 years of residency and many years of practice. I mean, that's a very different DNA than someone who is a hunter and gatherer, and someone that can actually ultimately drive something to help close. So that's really, I mean, across the board, that's been what I've seen. And when physicians are brought into that sales side of the organization, it's what you're describing, where I think it's more of a clinical subject matter, perhaps, right? And I think that expert, and I think that works. But I think we're trained to be like lone wolves, right? Like it's not a team sport, really, to be a physician, despite how much movement we've had towards patient-centered care and people working in collaboration. That's still solid, but at the end of the day, at 3 o'clock in the morning, the diagnosis is still yours to make over the phone or in the ER. And so I just think that it's been a real struggle, I think, for a lot of my colleagues who've tried to make that jump to then, kind of flip that and say the center of everything I'm doing is this prospective customer or this customer, and I'm going to actually, listen, and I'm going to take in input, and I'm going to be comfortable being disagreed with and being rejected, and having doors shut in my face. And it's just different DNA. So that has, been my observation.
So put your CEO hat on, and you're hiring. So, you're going to hire a sales manager, you're going to hire a sales organization, you're going to put them out there. You finally got your Series B and you're ready to really scale up. But, if you start putting those people out in the field, they're going to get hammered in those meetings. They're going to sit across from physicians and clinical leaders, and they're going to say, you don't understand the EMR or whatever. So you have to put somebody in a room who has the credibility and can say, hey, I've been in your shoes. Let me tell you how this works. Let me tell you why it's valuable to you. So you're not really putting them out there to sell. You really want the sales organization to sell, and the sales manager to manage that sales organization to the numbers and get the meetings and that kind of stuff. You really want them in that room to be that subject matter experts. But I think I agree with you in this respect. I see a lot of them burn out because they sit there after a while, and they're in their 15th meeting of the week, and they're going, what have I done? I mean, this is not what I signed up for.
Yeah. And I think it's so personal too, because when you've practiced, I mean, I'll use HealthFinch as an example for myself, right? When I practiced, I did refills all night, in the evenings, like that's what I had to do. And that was our product, automated refills. And so I had my methodology, I had my what I think about refills, what my emotions are about that workflow and my experiences. And so I think as a physician coming in sometimes in a sales role, you really need to understand that like your experience isn't what that potential customer's experience is, and holding back that urge to say you're doing it wrong, or like that's not how, and I think because when you're doing, when you're in sales, you're not necessarily the user of the product that you're selling, right? When you're a sales individual that's not a physician. And so that's sort of where I've seen a little bit of challenge. But all that said, I think it's all about setting expectations and really making sure. And that's one thing where startups, particularly, who has time, right, to even to create a lot of these processes. But I think the more you set expectations and let them know, like to your point, your job is to be the expert and to be able to relate and offer that credibility. I think it helps, but it's hard. It's hard to find those individuals that are comfortable, doing that type of role. So, the other challenge too is a lot of startups sort of build the product first and then bring in the clinical folks. And so I think getting someone in early that's that physician product expert is so important. I always say there's like two types of founders. There's the clinician founder, and then there's the tech founder. And individually, there's a lot of challenges with them. So getting those folks in sooner is huge.
I've watched this sales as a startup. I've watched the sales cycle on this thing, and the old adage is really true. 80% of your sales is going to be, word of mouth. Essentially, it's going to be me talking to another health system and saying, "Hey, we've got this challenge." They're going to say, "I use this thing. Call this person." That's a majority, and then your team has the lead comes from that, and then they go on from there. Either that, or your team comes in, and then I make the 3 or 5 phone calls I'm going to make anyway, and identify the other health systems that are using it. The catch-22 is if you're a startup, you have to decide, how am I going to get that reference client? And what a lot of people do is they sell ownership to get that reference client, right? So you end up with, money from Providence, money from a Cedars-Sinai accelerator or a Mayo or a Jefferson and that kind of stuff. And then you have to, and each one of those has their like network of health systems that are looking to them on how do we innovate. And so you get a built-in little sales thing. But then the next hurdle that you have to go over is you sort of sell into that whole little swath of organizations, and then you have to break out of that. And sometimes these health systems are in competition. So, as accelerators or investors and that kind of stuff, sometimes you see them cross, but other times it's like, nah, we have this solution and we're going to use it because we're a part of UPMC and this is what they're doing. There's so many barriers to cross.
There is. And, I think really about qualification. So, my whole spiel that I usually bring into an organization is really setting that engine and trying to, just like health tech itself, automating previously manual workflows so it can go smoother, better, faster. So as much as you can do that qualification, there's so many tools out there now, that you can use to research. And so even knowing that, okay, I'm selling a solution that's going to work better in a centralized organization, like a centralized call center type organization, because of the way that product works. And then really trying to hone in on finding those first eliminates a lot of pain, a lot of like duplication of efforts and just futile efforts, honestly. And to your point, landing in a third meeting only to find out that, well, that's just not going to fit because they're doing it this way, or they're already using this product because of the way they're doing it. And so it sounds simple, and you would think, people probably say, well, everyone qualifies, but they really don't. Being able to qualify against, these particular things saves a lot of headache as well.
Absolutely. Great article. She goes on to talk about the cultural challenges and some other things. It's out on Substack. You can probably just search for it by title, The Ultimate Guide to Hiring Doctors into Digital Health. All right, you're going to tee up. Let's see, what are you going to tee up? You're going to tee up price transparency. Look forward to this conversation. What do you got?
Yeah, that's been near and dear to my heart. We've worked with several clients on that pretty deeply. For some, building it, from the ground up. So it's been interesting. I've been following that for, I guess, almost a year now. And I think, it's really the first chance we've had to, as a nation, try to bring some of this transparency. It was unheard of, right? 5 years ago, like consumers knowing the prices of don't you just go to whatever your insurance, tells you to do. So I love that. I think it has the potential to to really disrupt things. But of course, like anything that comes from the government, it doesn't necessarily go through an outcomes review or an outcomes focused discussion, and it gets put in place. And there's a lot of arbitrary deadlines and things that have to be met without not a lot of focus. And I kind of think about the HIT Act, right? Like in 2011, the EHR happening so quickly with all this like industry motivation to do this and get stimulus money. And now look where we are with like an interoperability mess, right? It's like 18 years later, and maybe we should have thought it through better when we did that. So of course there's downstream consequences, but yeah, no, I think it's interesting what we're seeing, at Worldwide is there are the large organizations where you would look to them and say they have the luxury of having staff, having engineers and resources that can build this, because there's some pretty complex requirements of, machine readable files, and, it has to be able to pull this information from multiple applications within your EHR and PR, PM systems. So you would think, these large organizations, they have the staff, they're going to be quicker to do it. And what we've actually seen is a lot of these large organizations are on multiple instances of EHRs, multiple applications for their rev cycle. And so we're actually helping organizations like that because it's so much more complex. Those are the ones where you have to build it from the ground up. You can't just use Epic's price transparency module, right? Because you've got 18 different instances. So that's, there's that group. And then of course, the smaller health systems just don't have the resources to do it. And then the ones in the middle that are on one instance of Epic, they're winning. Like I'm seeing where, I'm going to websites just to do due diligence, and, the ones that are able to just plug in the Epic modules and customize it are doing great. But yeah, I mean, it's January, 30th, and we haven't really seen it being standardized across the board. And I'm kind of concerned of, health systems are going to make this deadline.
Yeah. So help me to understand, is this a dynamic price list, or is this something where you can go in and do the research, plug the numbers into a spreadsheet, make it into a machine readable file and put it out there?
Yeah, it's dynamic. I mean, you have to be able to, based on that consumer's health plan, be able to access this information. So, you're pulling information from your contracts applications, up to your negotiated rates with your payers. You're pulling information from your charge master, which for a lot of these organizations, there's a lot of cleanup and work that has to be done there. And then being able to, display that in a consumer friendly, which is actually like, I think the wording in the transparency rule format. So it's pretty complicated on the back end as far as the data sources, unless you're in a unified single instance of a lot of these different applications already.
Yeah. So the article goes on and talks about a handful of things. One is, the challenge with this is clarity. They don't tell you, it's like, just put it out on your website. Okay, where do I have to put it on my website? I'd like to be able to hit the, 15 websites in this state of certain hospitals, pull all that information in, but I have to find it on those websites. It's not readily available. And then, as you noted earlier, it has to be in a patient-friendly format. And that's really not something that's really well defined either. And so you end up with some people actually publishing a sheet that you can download and take a look at. Other people are using their price, a tool, an actual tool that you put in some information and it pops some information out. And so there's a lot of different ways to do this. From where I sit, the federal government is doing, the price transparency makes perfect sense. If you're trying to drive down costs, transparency is one of the ways that you drive down costs. You give me options of where to go and you give me transparency. I get that. I understand why the American Hospital Association is actually fighting this a little bit. I assume they're fighting it because it's not as clear as it could be, and they have to, essentially put their pricing out there. I mean, we don't go to Walmart and say, show us all your negotiated prices.
Yeah.
And there's no other industry we do this in. So,
yeah, I mean, there's been First Amendment, challenges, arguments around this whole thing. I think in my opinion, and I'm just, a nobody, but I think that, we probably are going to move the needle more if the next rollout of this is upheld, which is up in the air right now. But having payers do this, right? Because I think like, if you live in a mid-sized to small community and there's only like one health system and maybe another one an hour away, I mean, it's great to see like what the pricing is, but do you really have that much control over what you can do with that, right? I mean, it's what does your insurance cover, who's negotiated, and this is where you're going to go. I think it's good just holistically that it's putting pressure on hospitals to examine why is, colonoscopy, I'm going to make up this number, like $5,000 here and like $33,000 here, right? So that's good. But I think what'll be valuable to the consumer is when payers are forced to do that. And I think originally that was supposed to happen like by 2023, because then you can really see like, I have Aetna. It's like $18,000 for this procedure, but look over here, a local state run payer, it's, $4,000. And I think then we're really creating competition in the marketplace. And I think that, in my opinion, that's really where we're also going to see probably more value from this type of transparency.
Yeah, well, to a certain extent, you get some of that transparency with this because if they're showing the negotiated rates, you see some of it. But I agree with you that the next round will be more interesting. But in the story, they have, some of that comparison. A high volume radiology code ranged from $90 to $2,033. And there's another, wound care. Certain wound care was $505 for Care First, but $4,138 for Cigna. And
that's crazy.
And that's the kind of stuff you only see that through transparency. And here's the other thing from again a startup standpoint. I think there's a whole bunch of data companies right now chomping at the bit to get at this information, put it into a tool, and put it out on the App Store, put it out on the Apple App Store to say, okay, we now have information. Go in and look at these shoppable services, and much like GoodRx and that kind of stuff, you can shop those services. So it's just a matter of getting everybody to put it out there.
Yeah, no, I agree, and I think that I've actually read a lot of articles around, the value of it. And then if you fold in these, because with the payers, it'll be beyond the shoppable. Like it's like they're going to be asked, I think, by whatever year, if it's upheld, all of their codes and the charges for it. So yes, I mean, I'm reading that startups are salivating at the opportunity to then, curate this information and do all sorts of things with it. So it'll be interesting to see.
All right. Well, here's what we're going to do. We have some predictions here. We have a Fierce Healthcare article with 7 predictions for healthcare. And I'm going to go through them, and you and I will just go back and forth a little bit on each one. And then you have a couple of predictions. I have a couple of predictions. So I thought we'd close out the show with some of our predictions for 2021. Does that work for you?
Yeah, it's great.
All right. So Fierce Healthcare, the story title is 7 predictions of what lies ahead for health tech in 2021. That's Heather Landy. It was actually written in December, as you would imagine. Let's start with the first one. Consumers will be in the driver's seat in 2021. My thought on that is, I think that's more aspirational than practical. Options have increased, obviously, and we have new. I mean, let's say it this way: the patient's experience has gotten a lot better. There are more options, but to say we're in the driver's seat, to say consumers are in the driver's seat, I think is probably more aspirational than practical. What are your thoughts on that one?
Yeah, I tend to agree with you. I think though that it has been, we've actually seen where patients are now actually voting with their feet. I mean, we've talked to a couple of health systems that said, boy, we were so underprepared. What we consider the patient engagement tool at our organization is our portal, right? Like our EHR portal that's, like written in, the code from who knows when. So,
right.
So as consumers, it's like 3 a.m. Do I have COVID? I want to be able to go and do some sort of, triage, like a digital triage, or boy, my telemedicine experience was so bad. I had to open 3 different apps and then it didn't work. And then I couldn't get, and we've heard them say, and we're losing patients, like the health system down the road, especially in like, cities, has a much better kind of retail like experience. So it's the first time I'm sort of hearing that. And I think, consumers are feeling more empowered to say, this isn't good enough. Like I want the Wayfair experience or, the whatever apps they like to use. So yeah, I think it'll fall somewhere in the middle of that where, that they're going to feel more empowered because of what they've experienced with this unprecedented surge for need for care during the pandemic.
The word portal sort of says it all, doesn't it? It's sort of like having an AOL email address. Anyway.
Yeah. Yeah. And also, Bill, I think being able to go to the big box, offerings now, like, okay, I can't get what I need for my health system. I'm just going to go to CVS and, or, go to the hub or go to X, Y, and Z. That wasn't as much of an option even, a year ago as it is going to be and continue to be as we move forward.
Yeah. And the number of tests that CVS, well, I think their number 7 prediction, but we'll get to that. But I think CVS probably did more tests than any health system in the country, just because of their scope. And my guess is when all is said and done, they will probably do more vaccinations than any health system in the country. That's my guess.
I agree. Yeah, I agree with you.
Number 2, virtual care services will expand, but there will be risks. What's your take on 2021 for virtual care?
Yeah, I'm always kind of following this and looking at what CMS is doing here and there with these regulations. I do think that it's, I'm not the first one to think of this, but I do think it's here to stay, right? I mean, I think there's going to be a rollback on certain things. Like, for example, like we made physical therapy virtual care allowed for the first time ever. An emergency, is that going to continue? Like, who knows? Like, some of those things might reverse, but I think that the surge numbers, like where were we, like close to 50% at some point of usage of virtual care, and now we're predicting somewhere like between 20 and 30. I think that's still a lot more than like 5, right? Like where we were before. So I think, I know actually, like every organization I talk to, there are no plans to pull back on their virtual care solutions. It's just about how do we tighten them up, align them, unify them, and scale them moving forward.
Yeah. Virtual care the 20 to 30% is let's just say an appropriate correction. We sort of threw everything at telehealth, and some of those things weren't real well suited, but during a pandemic, that's what you do. So it comes back 20 to 30. Those are decent gains. We should cement those gains and call that a day, and then start building off of that, start going to home care and other kinds of things. So I think that's almost a no kidding kind of prediction. Virtual care services will expand. We're still in a public health emergency. Of course, they're going to continue to expand.
Yeah.
And the next one, I'm not even going to ask you to comment on because it's also a no kidding. Cash will continue to flow into digital health. It is flowing, and it is continuing to flow. Livongo has made sure that the money will continue to flow into it. 2021 will be a pivotal year for machine learning and artificial intelligence. Okay, what do you think about that? Pivotal in what way?
Yeah, I kind of chuckled at that one because I've almost been doing this for 2 decades. Like, how long have we been hearing like it's the year of AI and machine learning? I mean, I remember going to HIMSS many, many years ago, and so I don't mean to be cynical, but I mean it's always been top of mind. I think what's interesting now is that it's, I don't want to say like commoditized, maybe democratized, where health systems themselves, as we talk to them, are saying, oh, we've hired data scientists, like we've hired PhD data scientists that are helping us build this and that for social determinants of health, or and you didn't hear that like 3 or 4 years ago. So I think that to that point, then yes, obviously the prediction is accurate that if anything, just the inequities that we've seen and our inability to capture that information, I mean, 80% of that is like narrative information, non-structured in an EHR, right? Like, how do we even know someone's social situation? And then more importantly, how do we, reach out to them? So I think it's just it's more widely accepted now that there's a role for it in health systems. And then in life science and pharma, my gosh, trying to crank out a vaccine, right, in 3 to 4 months, if you don't have a strong AI machine learning play in your R&D acceleration, if you don't have high performance computing infrastructure to support it, then you're behind the times. And we saw how that played out with the organizations that kind of won that race.
Yeah, I would say in addition to that, I would say the other area we'll see this is RPA, robotic process automation. We'll see back office systems. We'll see more IT systems, security, machine learning, and AI being layered in. So I think it is going to be a year that it sees significant growth in those areas. And the clinical side, it just has to move at the pace of safety, right? So you just have to be it's almost like introducing a new drug. You can't just introduce new algorithms and say, hey, let's launch this and do that. In the clinical setting, it will continue to go slow. In the research and development area, it can go fast. In the administrative side, it can go fast. So we'll see what happens. I'm not going to ask you to comment on this one. The shift to cloud will ramp up. Cloud has been ramping for a while, so it's going to continue in that direction. And number 6, Walmart will redesign healthcare, and so will Amazon and Alphabet. I think all three of those are going to do it a little differently. I think. Walmart is already scaling up. Well, I mean, they're already rolling out their larger clinics. They used to just pop them into a store, and now they're actually building larger facilities in the parking lots. Those are pretty integrated type facilities. I mean, they have dental, they have behavioral health, they have imaging, they have you name it. It's a pretty well thought out model to build those out. Now, there's only maybe 5 or 6 of them in the country right now, but yeah, that'll scale out. Amazon's doing Amazon Health with their employees, and we'll see where that goes. And then Alphabet is really, their partnership with Mayo is really fascinating to me, and I think they're going to continue to be the player that you take this health data to, you anonymize it, and you generate insights from. So each one of those are going to make different contributions to redesigning healthcare. What are your thoughts on that?
No, I absolutely agree. And I think, if we touch on Walmart, I mean, just how much they've already invested in scaling, how many clinics we know they're rolling out in the next 2 quarters. I mean, it's working. I mean, I think about myself, like I go to a very well-known national health system for my care. I have had times where I've called like 3-4 times within 2 hours, and I can't even get a human to answer. I'm wading through layers and layers of, just people and barriers. And wouldn't it just be great to walk over to Walmart and get my care? I mean, it would. And I think that their health systems, we touched on this earlier, but are going to see some competition there. And I think it's the consumers are going to accept this, quite readily as they start to experience this new kind of retail experience of care where you're not on hold and you're not being, forced to wait and be told things when you really want to be able to be given a choice and have it be done on your time and your convenience.
Yeah, and that gets pretty close to one of my predictions, so I won't go there. Social determinants effort, last one. Social determinants efforts will shift from aspirational to operational. I hope that's the case. We did an interview with Intermountain and the United Way, and the stuff they're doing in Utah is fantastic. But you also hear when you talk to them the complexity, the partnerships, it takes institutional will. I just think it's aspirational. I'm hopeful that will happen, but given that a lot of health systems took when we did the elective surgeries and we took those out for 3 months, that set hospitals back a little bit, and so I think this is aspirational for 21. Hopefully, we'll pick up the pace again in 2022. We'll see.
Yeah.
All right. I agree. Go ahead.
Oh, I was just going to say, I agree. I mean, when my second startup I had, we worked with about 3 dozen different startups, sort of help them launch whatever it was, product, commercial, sales. And I had the fortune of working with a company called Pieces Technology. I think they go by Pieces now, and they've been working on this for over a decade. And when you look at how complex it was, they really kind of pioneered working with local community organizations. They're all on different technology platforms, right? They're all using different CRMs and things like that. So they had to overcome that. And the health system, UT Southwestern Parkland, health system at the time, they had to invest the dollars, like to your point, and that they recognized the value of that, the ROI of that, of the reduction of readmissions and identifying people proactively to treat them differently upon discharge. They were very forward thinking. And I think to your point, it hasn't been widely accepted. And now the dollars may not even be there, but I think it put it on the map. And I think that, with organizations looking at the forward thinking ones that knew this was coming almost a decade ago, I'm hopeful that we are going to see a uptick on this, maybe for the first time as a health care, a company and a country of how we're delivering healthcare.
Fantastic. So, it's pretty easy to sit here and poke holes in other people's predictions. Let's throw out some of ours. So I'll let you go first. What's a prediction that you have for 2021?
Yeah, I mean, I don't think I'm the first to predict this. I think we touched on it, but I think there's going to be a lot of expansion of how we already think of remote patient monitoring, but also some disruption and innovation on how we think of, remote patient monitoring. I think before the pandemic, there was some focus on chronic disease populations, right? I mean, they overutilize healthcare resources disproportionately to the percentage of what they represent in the patient population. So, diabetics and going home with glucometers, or congestive heart failure patients with scales and things like that. But even then, it was a very, very small percentage of health systems that were doing it. And so absolutely, I think that's going to scale as we've seen what's happened to heart failure. I mean, we have a 50% increase in mortality for heart failure patients during the pandemic because they couldn't come in. So, realizing that, boy, we should do a better job taking care of them at home. But I've been really excited about the work we're doing with organizations around even acute care remote monitoring, right? So, I mean, COVID obviously triggered that. Let's send people home and from the ED with a pulse oximeter and collect that data, passively and react to it. But just seeing it in general, pregnancy. What if we sent everyone at high risk for, preeclampsia during pregnancy home with, blood pressure cuffs and things like that to prevent? What if even in urgent cares or EDs, when people have 3-hour waits, putting them on some sort of data collecting, device where we're able to track and send the, appropriate notifications. So there's a lot of that going on. And, we're actually kind of working on some of those first time solutions in those spaces. So I think that I predict that that's really going to take off as well.
Yeah. And I think one of the enablers for that, and not to comment on yours, on your prediction, one of the enablers for that is going to be, I think the digital divide last year became really apparent. And the fact that we sent these kids home to study from home, and they didn't have broadband, they didn't have computers. There were people that tried to get into telehealth and whatnot and couldn't complete the call. So I think one of the first things you're going to see is an infrastructure project out of this administration. And part of that will be to address this broadband and this digital divide that exists. Yep. And I think healthcare is going to be at the center of that conversation. And that's gonna give us a even broader foundation to deliver what you we're just talking about, this remote patient monitoring, remote acute services, and those kind of things. So that'll be interesting. All right, sorry about that.
No, I agree 100%.
So, my prediction on this one is that the federal health emergency is going to continue through the end of this year. I don't think we should anticipate any change to that status. And what that means is that the telehealth funding will remain in place through the end of the year. The state's moves at this point are mostly for show until the emergency is lifted. And what that means is, with telehealth funding in place, really at parity through most of 2021, health systems are going to have the opportunity, and the opportunity is to build out their capability and with that viable funding stream already in place. So now the design, whatever you do around telehealth and those kind of things, the design is going to have to take into account that the funding won't always be at parity. It will change based on research that'll be done this year based on the data that was collected over the pandemic. Obviously, you'll see in behavioral health services, I think that will continue to be funded at parity moving forward. Other things they're going to look at what the efficacy, what the amount of usage and the quality and the outcomes, and determine what level it's going to be funded at. But the good news is you have a year. You have a year to build this out, to really cement those gains and to build out a program. And with funding for a year, there's an opportunity to build it with an eye towards, okay, maybe in a year from now, we have to find our own funding source for this. And it could come in the form of lowering the cost of delivering services. It can come in improved efficiency or even in outcomes. Or it can be, as you were talking about earlier, the ability to draw more people into your health system because you're offering those services and others aren't. So that's sort of my prediction for the year. Unfortunately, the federal health emergency will continue. We'll have a funding source for telehealth, and health systems will have a really now about an 11-month runway to really cement the gains in telehealth.
Yep, I agree.
How about you? What's the next one?
It's I hope it happens, maybe more than it's a prediction. I was really, as a pediatrician, I've always sort of followed like alternative treatments for things like ADHD. It's amazing how much of that we see as pediatricians, right? I mean, you only hear about the cases where they're hyperactive and, you put them on Ritalin and, they're disruptive, but it is so much more common than we know. And it's sometimes the more subtle cases where it's inattention, having trouble kind of focusing on things that you need to focus quietly. So you may not be as disruptive. And so people don't notice. So I've always been really fascinated and hopeful that there's other solutions. And so I think with digital therapeutics, for the first time, we've seen, FDA approved digital therapeutics that are software based. And, when we look at, Achille, I believe, is the one that did the one for software for ADHD and like proven efficacy, at the level of therapy or even medication. I think that that's really exciting for me as a health tech person to see us doing that for the first time. So things like substance abuse and mental health challenges around, insomnia, even like with, I think, pair therapeutics. So I'm really excited to see more of that happening. And I've known over the years, just chatting with entrepreneurs from idea stage to, okay, we've received, Series A funding and we want to get this done, that pivotal acceptance with the FDA happening this year. I'd love to see that market explode.
Fantastic. My last prediction, and then we'll close up, is there's going to be a return to bundle payments and an emphasis on bundle payments. This is not rocket science because this is what we saw during the Obama administration. I think we'll see return to that in the Biden administration. And the reason I look at this as a CIO is because orchestrating the continuum of care becomes critical. And it's really from diagnosis until recovery. And in some cases, the patients are moving in and out of your health system into different care venues that aren't controlled by the health system. So, but the main entity is responsible for controlling quality and cost across that continuum, regardless of if you are the hospital or if you have the recovery and the rehab or you don't. You have to still control it from one end to the other. So we're going to need technology to orchestrate the experience, manage and measure the quality, move the data around the ecosystem is going to be critical, and likely move people into lower cost venues as quickly as possible. So there's just something to keep an eye on when those bundle payments come back. We are going to be really tasked with making sure that the data moves across that entire continuum, we track it well, and we can deliver at a high quality level. So that's so if people want to comment on our predictions, feel free to do that online. We would love to get your feedback. Sanaz, thank you for joining me today. This has been a wonderful conversation.
Yeah, thanks for having me very much.
We'll have to do it again. That's all for this week. If you know someone that might benefit from our channel, please forward them a note. They can subscribe on our website, thisweekhealth.com, or wherever you listen to podcasts. Apple, Google, Overcast, Spotify, Stitcher, we're everywhere. We want to thank our channel sponsors who are investing in our vision to develop the next generation of health IT leaders: VMware, Hillrom, and Starbridge Advisors. Thanks for listening. That's all for now.